again, the topic today is peer-assisted mental health care inside the country's largest jail. And we're going to be looking into a very innovative program that was initiated at L.A.County Twin Towers several years ago to give you an opportunity to hear from people who were involved in envisioning this program, and actually a couple of the inmates who have actually lived embedded in this program for ever since 2017. So the people you're going to be hearing from today, Craigen, Armstrong, and Adrian Berumen, are both mental health assistants at Twin Towers Correctional Facility. You already just saw for a moment Dr. Philippe Bourgois from UCLA, my kind of co-partner in preparing for this today. Bruce Chase, the Assistant Sheriff of Custody at L.A. County Sheriff's Department, although I think he may have just had a change in duty, which he can tell us about here in a moment, but he's very intimately knowledgeable about the custody operations of the L.A. Sheriff's Department. Joan Hubble, who is the Mental Health Program Manager at Twin Towers Correctional Facility, and Jeremy Levinson, a PhD candidate at UCLA School of Anthropology and the Center for Social Medicine, and myself. So we also want to provide a shout out to our friends at the Weill Cornell Medical College back in New York, and Richie Hong, who actually was the person who presented this idea to us many months ago. And it was the seed of a great idea, and it has blossomed into this panel today, which is really bi-coastal. So welcome to all of you on the East Coast. So let me just set the context a little bit. In our American mental health system, we have essentially abandoned a cohort of people living with serious mental illness who have been deprived of consistent and sustained mental health treatment in community-based settings, which is what we always thought was going to happen when the state hospitals closed decades ago. The end result is the exile of people struggling with their mental illness to a life of homelessness or incarceration or both. The L.A. County Jail has the dubious distinction of being the largest mental health institution in the country and possibly the world, by default, certainly not by plan. On any given day, approximately 5,000 mentally ill inmates across the L.A. County jail system are in custody. The most seriously mentally ill are awaiting trial, and they have to be prepared for that experience because they are not capable of comprehending the courtroom practices or the charges that have been levied against them. So in 2017, officials embarked upon a pilot project in the forensic inpatient step-down unit to create a specialized dorm setting for the most seriously mentally ill patients to accommodate more intensive treatment and encouragement, and to prevent isolation, to prevent decompensation and rehospitalization. In addition to providing more frequent access to clinical staff associated with the jail's mental health division, 2 inmates from the general population who are not mentally ill but are awaiting trial were selected to live in the 2 special pods. They are mental health assistants. Lesson learned from the successful pilot that provides the opportunity to integrate peers with clinical therapeutic support, helps to inform similar replications in jail and prison facilities throughout the country and possibly the world. And you'll see in a few moments that the 2 mental health assistants here today actually wrote a book about their experience, which of course we will shamelessly promote on their behalf toward the end of this session. So we're going to approach this talk today in 3, you got a picture over there, Philippe, you can hold it up. We're going to talk a little bit about the status quo, the state of mental health care treatment in the carceral system in the US right now. That'll be the first section. And then we'll move into LA County and the implementation of the mental health assistant program as a pilot. And then the third and final section, we'll look at what does the future hold. So I have already briefly introduced each of our panelists today, but I'm going to ask each of you to respond to a question and briefly share with us. I'll start with Bruce Chase. Tell us, Bruce, a little bit about your background in the LA Sheriff Department and how you ended up making your way to the Assistant Sheriff for Custody Operations several years ago.
Hi, thanks, Carrie. Good afternoon, everyone. Yes, so I have 32 years on the Sheriff's Department. So I've worked my way up through the ranks, starting out, back in the late 80s as a deputy sheriff assigned to work in the jail facilities. And then it's just been a steady progression over the years up through the ranks. Back in 2016, I was assigned to the executive offices of custody operations, working in the chief's offices. And I started to become familiar with again, refamiliarize myself with the things that we had in progress. In 2015, just so everybody knows, that there were a couple of settlement agreements reached in federal court justice, which had us agree to implement a number of reforms with how we were treating the inmates with mental health issues. And so that's where one of the federal monitors, actually Dr. Bruce Gage, was a real proponent of the program that now Craigen and Adrian are working on. In 2018, I actually was put in charge of the unit that was responsible for our department's maintaining compliance with several of the settlement agreements. So I became more involved. Then I was promoted to chief of half of our custody operations. And then in December of 2019, I was promoted to the assistant sheriff, put in charge of managing day-to-day operations of our entire system. So that involves 7 facilities, and pre-COVID, it was a little more than 17,000 individuals in our custody on any given day. Because of COVID, we made a lot of modifications and changes, but currently the total population is about 15,000 on any given day across the facilities and in our reception centers. And as you alluded to, Carrie, the mental health population has been increasing. So even as we've seen our overall population decline, all that it's done is show it's exacerbated the percentage of individuals that actually have mental health issues. So the percentage of those with mental health issues has actually increased, even though the total population has declined. And that's just it in a brief nutshell.
In a brief nutshell, I know that's a lot. Joan, tell us a little bit about your background and how you arrived at Twin Towers.
So I am a licensed clinical social worker, and I worked for about 15 years with teenagers on probation. And I really worked in every, almost in the juvenile system. I worked for the courts, I worked for probation, placement, and I loved that work so much. And then that's what led me to work in the adult system. It's very similar, the same population, really just at a different age, same, very similar challenges. And so I've worked with the mental health department within the L.A.County jail for the past 10 years. And I've held various different degrees, which led me to where I am now as the acting mental health director.
Thank you, Joan. We're so glad you're here today. Philippe, tell us a bit about your background and your particular areas of study and how your work intersects or intersected with Twin Towers.
Sure. So I'm a cultural anthropologist, actually, although I'm in a medical school, and I study substance use disorders and survival on the street for homeless people. And I began my work in the mid 1980s, and then all of a sudden watched everyone suddenly get locked up and realized I needed to go to jail too to know what was happening. And that was a tremendous, and I'll show some slides later should I show them now, Carrie?
No.
Okay. Yeah. So, and that's how I became a volunteer for the sheriff's department for the mental health unit, and thanks to the sponsorship of one of our MD PhDs, who's a psychiatrist in Yelena Koldubskaya, and Dr. Yelena Koldubskaya, and there on the very first tour, I was taken to to be shown the mental health assistant program. I didn't meet actually Adrian and Craigen at that time because they were busy, because they're always busy doing stuff. And I said, wow, this is amazing. And actually my first question to the person who was showing me was the former head of mental health, who's retired now, Dr. Ortego, was, why isn't this expanded? He said, yeah, we this really works. This should be expanded. And it's great to see now. And I think that's why I wanted to just congratulate Assistant Secretary Bruce Chase that it is being expanded, I think largely because of your support. And I wanted to thank you for that, because that's so important. And we should all recognize the significance of, as I understand it, you're the number 2 person in the Sheriff's Department. You were too humble in your self-introduction. I'm not sure if that's true.
So I'm actually one of the number 3s. So there's the sheriff who's elected, then there's the undersheriff, and then myself. So I could be number 3.
We'll take it. All right. So Jeremy, tell us a little bit about, I know you are a student, but how it is that you intersected also with Twin Towers and met Adrian and Craigen in your particular area of interest.
Yeah. Hi, everyone. I'm a doctoral candidate at in medical anthropology and social medicine at the Center for Social Medicine at UCLA. I'm also actually a 4th-year medical student at Mount Sinai in New York City. And I think from my background, I had a really profound experience when I was a first-year medical student visiting and volunteering at the Rikers Island jail center. And I learned a tremendous amount from some of the physicians there, the wonderful leaders there, like Dr. Ross McDonald, Dr. Zach Rosner. And it was the complexity and challenge of correctional healthcare really inspired me and ultimately led me to take a leave from medical school to pursue a PhD so I could learn more about this complex social problem. And then actually in 2017, I think it was, Dr. Joseph Simpson gave an amazing grand rounds at UCLA and really inspired me to actually shift my attention from Rikers Island to the LA, to Twin Towers. And so thanks to Dr. Koldovskaya, I was able to volunteer. And then that's where she introduced me to Adrian and Armstrong, and we've been in touch ever since. So a lot to say about the lessons that I've learned from many of the wonderful people along the way, but that's the basics.
Thank you, Jeremy. And now, Adrian and Craigen, if you could share a little bit about, just very briefly, because we will have more time to go into greater depth, but how it was that you became mental health assistants.
Yeah, so the mental health assistant program was developed later on. We started out as merit masters, and that started in the Los Angeles County Jail. So, through that program, it initially was the EBI program. It's administered by the Los Angeles Sheriff's Department. It's a school program that teaches the various courses, life skills. You have job preparation, parenting. And through that program, you're able to apply for the Merit Master program. And the Merit Master program was the way to participate in Twin Towers assisting in mental health. So, and through that, we developed the mental health assistant program, because coming over from Los Angeles County Jail, we didn't, you don't learn how to, work in this environment. You're not trained in that sense. So over here, once we got over here, we was kind of like thrown in it. It was in its infancy stages in the beginning. So we really didn't know too much. We were just in the pod, kind of working, taking care of the guys. And from what we were experiencing at the time, we felt it was necessary to develop some type of training program for other men who want to do this type of work. So we knew that the Merit Master, that program will be sending other guys over eventually. And we took it upon ourselves to say, okay, we need to kind of develop something for these guys coming over so they understand what they're really walking into and how to deal with the situation, how to, treat the guys. And it helps the guys too, the patients. They get someone who's well-informed and trained. And so that's really how the mental health assistant, all that came together, was because we felt it was necessary for guys coming over who are really unprepared to be in this environment.
It was about 2 years. Go ahead.
I was going to say, yeah, Adrian, when was that? How many years ago?
It was about Yeah. So like we've worked over here about 4 years now, but 2 years in the position, that's when we created the mental health assistant position.
Okay.
We originated as merit masters.
Okay. All right. You're going to have more time to elaborate on that. Thank you both. And look at how far it's come. You've got 170 people listening to what you're doing. So good result. All right, Philippe, let's kind of go back to the status quo, where we are right now in this country. You know, can you give us like a brief background? I know we could do a whole seminar on this, but how did we arrive at what some people would call trans-institutionalization? We closed down one set of institutions and we've possibly just shifted people to another set of institutions, being our system of incarceration. I think you might need to unmute yourself, Philippe. Philippe, you're muted.
There. Okay. Sorry about that. You can see the PowerPoint I have up.
Yes.
It's a complicated one. And it basically has the information. I put too much on it, but if we don't have to see the next ones. Basically, the way I would sum it up is that a perfect storm of policies, of just inert social structural forces and transformations in American society started occurring, where the fan hit is in 1955, where you see on the top line this dramatic beginning of an extraordinarily rapid decline in the number of public health psychiatry hospital beds, when it all used to be in the state hospital system. And then that there was a hope at that time that the first antipsychotic drugs of the kind that are dominant now were first invented, and there was a hope that would have a magic bullet effect and enable people to get out of more confining environments of hospitals and allow them to live, more independently in the community. And that magic bullet, medication is super, super, super important. People rely on it, but it doesn't work for everyone, and it doesn't work for the same person necessarily their whole life, because metabolisms are different, and we still don't understand the brain well enough to understand how complex it is and how the medications work. So you then see the shifts in policies for how things get paid, and that became a hot potato between the federal government and the states, each one trying to sort of pass the hot potato to one another, and that sped things along. And then there was the whole rise of civil rights and civil liberty movements in the late 60s and 70s, where people were demanding their civil rights and so forth, and that created a set of laws. California passed it's famous it's called LPS laws for protecting people from being locked up without a hearing and trial. So that all created unintended consequences that kept throwing more people soon into that eventually created this trans-institutionalization problem, or began it, where you see the number of prison beds that basically was pretty much stable up until 1974, when it was about 3 years after Nixon had declared the war on drugs. No one paid that much attention to that. It was just a politician on a bully pulpit. But then he started also using that to also shut down the expenses on public housing. And then all of a sudden the uptick started. And the uptick was beyond everyone's wildest expectations. And we weren't really aware of it even, because you don't see things happening when they're happening. You can only see them on a graph. In retrospect, hindsight is wisdom, but we never have it at the time. So you see, and what's really interesting, because we always talk about the California 3 strikes law. I think it's because Hollywood is so important and everyone pays too much attention to California. But the 3 strikes you're out law was just one little tiny event in this massive buildup in the number of people incarcerated. And the people that got most incarcerated incarcerated were. And this is in this Assistant Sheriff Bruce Chase was saying that this was what's happened is, even as carceral populations, and I'll jump to that slide because I did, if I can learn how to move my slides forward, which I can't. So that was stupid. Oh, here, let me just, this shows you some of the costs of what happened to people with serious mental illness, because one can polemicize and so forth and have positions. I think where the buck hits the, whatever goes on the tarmac is you see how many years of people's lives are lost since the 1970s when they have serious mental illness. And you see they were losing, 0.8 of their life. And then that jumped up between the 1970s to the 80s to 3. And then it's kept on going up slower, but still, dramatically 3.2 in the 1990s, 2000s. And this is people with schizophrenia, which is only one of the diagnoses that are what we call the psychosis spectrum disorders. So here you also see another perfect storm that none of us saw, none of us understood. And that's basically the magic of science got taken over by investment bankers in pharma, and they invented that model. That wasn't, it's interesting. It was in psychiatry on the most vulnerable people possible in a country that the biggest profits were made, in the model of big pharma that's now extended to every single medication that we depend on to survive, whether it's rheumatoid arthritis or our vaccines for COVID are extraordinarily for profit when it's, that creates a transformation in how much medication you get, because they then changed how medical students were taught and how much time a psychiatrist has to see a patient in their clinics. So psychiatrists no longer have the long times. They were able to have, they used to in the state hospitals, they could be an hour, with a patient and listen to them and talk to them and practice therapy with them. Now they've got to move on to the next patient and do it fast. And that's where more and more of a reliance on, and that was the brilliant insight that Craigen, Armstrong and Adrian Berumen actually taught me about, because they actually simplified it to me, saying, actually, what we're really doing, just to summarize it, and I won't go on too much longer, is we're just trying to be their friend. We're just, because they're socially isolated, and that's what they are craving. And the biggest suffering for a person with serious mental illness is that everyone is fleeing from them. People are chasing them away. People are arresting them. People tell them they smelt badly, whatever the thing is. And that's what hurts them, because human beings don't want to be alone. We hate being alone. And here you see the jump in the number of homeless people. That's another separate process that was taking place. That was our failure to invest in public housing. We just stopped, and boom, you see exactly what happened. That dropped. That just between 2010 and 17, there was a doubling in unsheltered homeless people just in Los Angeles County, because we get harder hit than just about any other city. And here you see the transformations also of our psychiatric hospitals. They're no longer civil commitments. Those are practically disappeared. People are in there only for serious criminal charges. And in the past, serious criminal charges just weren't given to people with mental illness. They weren't held responsible in that way for understanding the crimes that they had committed. And that's changed. And here we see, this is what I was talking about before. This is where we see this rise in the L.A. County Jail, how it affects an individual, just one individual prison, even as the population of inmates is going down. So the graph of inmates, of general inmates, is going in the opposite direction. The graph of people with serious mental illness is doubling. You can see between 2009 and 2018. And it was I think Dr. Ortego that gave me these statistics when I was initiating this. And so that in a nutshell shows you some of the social forces. These were unintended consequences, and it was that perfect storm that, in some senses, crucifying people with serious mental illness and catching them in a cycle that sends them from homelessness into jail. No one wants them in jail. The guards don't want them in jail. No, the officers don't want them in jail. The deputy sheriffs don't want them in jail. And boom, they don't want to be in jail, and out they go. They don't want to be socially isolated either. They want care, and one of the only places where they get care is in jail. So that's the magic of Adrian and Craigen, is that they figured out on their own basically what psychiatry had forgotten, which is to treat people with serious mental illness as a real human being who one wants to befriend and doesn't want to leave socially isolated. And now I'm stopping. I've talked too long. Sorry. And do cut me off, Carrie, when I go on long like this. Please.
Philippe, people are asking for your slides, and we will. Those are that really does tell the story. And there are people clamoring for Adrian and Craigen to speak. Don't worry, they will speak. We are just trying to set the context for why it is that we are in this pickle that we are in this country. And so I do want to kind of shift over to you, Bruce. So obviously, Philippe has shown the trends in L.A. County. And you can stop screen sharing now, Philippe. So, what are you noticing? You mentioned before that the proportion of inmates with mental illness have been increasing. And I know that is certainly not something that you've all felt prepared for. Have you done your own thinking as to what are the trends that are behind that? What's causing this concentration?
Yeah, so it's just a layman's perspective, obviously not the medical perspective from my point of view, but one of the bright spots that Philippe pointed out, that Craigen and Adrian, it's like two individuals that have been with us for a substantial amount of time, and two guys that have lived experience and have been out, in the neighborhoods and are now with us based on some serious life-changing events, but that went through the EBI program they referred to as the education-based incarceration. And they became merit masters because, rather than sit here idly, it's individuals like this that are just trying to make themselves better, but they see that the process that we've been using in society and in L.A. County and in general just hasn't been working, right? So we have individuals that cycle into our systems, with various mental health and substance use disorders, and then we cycle them back out on the street, over a series of time with minor offenses until something, serious happens, and then they're stuck with us. So it's like, that's what I see, where we're hopefully turning the corner across the nation and here locally as well, but building up, not having the programs and the care, focused on the mentally ill in the jails, as Philippe pointed out, might not be the best, the best model, but it's what we're stuck with right now. But we're trying to help individuals before they go back out without the tools to succeed and just end up back inside. And then again, as I was saying, the cycle can repeat itself until something just serious, incredibly serious happens. And then they're going to be here for a while longer. But that's the trend I've seen, where we're not providing enough services in the jail model, right? It's not the ideal treatment space. Our facilities are older. They weren't built, to be mental health treatment facilities. So that the medical staff and the doctors are doing the best they can. And so that's why the population just keeps increasing, because we've allowed, we've been able to release some, lower level offenders, but it's a catch-22 if we do it under the model that I just outlined. If we're releasing lower level offenders, but we're not getting them adequate treatment and giving them the tools they need in the community to succeed, it's just a cycle. The cycles of incarceration repeat themselves until there's, catastrophic consequences. So I think that's something we're all working to try and change. And that's why just seeing, Craigen and Adrian and what they've done and they'll get a chance to talk, but I can't say enough about the fact that you have two individuals here that are working with some of our most highly, acutely mentally ill individuals but on a human level, because they understand from interacting with them on a day-to-day basis, inside and outside, kind of what they need to succeed. And so, I don't know if I rambled off topic there, but it's something that we need to change, just the way we've been doing business. So I think that's why we're all here.
Very good. Jeremy, I'm going to skip ahead for a minute. I'm going to circle back to you. What I want to do is give Joan a chance to describe one of the things I always found interesting, when I finally did tour L.A. County Jail, is that I never imagined that there would be a mental health division within the jail. So tell us, has that always been the case, that there would be a special mental health division in the jail? Tell us the difference between who is an inmate and who is a patient. What happens if someone is too sick to stand trial? Just some of the basic concepts there. And then if you could segue into what were the precipitating factors that contributed to the design of this program that we're here to talk about today, the mental health assistant.
Sure. You might have to remind me some of those if I go down a path. But first, the history of mental health. I find it fascinating too. We started back in the 90s. They had, actually, it's interesting how things come full circle. They had a day treatment program, and it was like full day, all day groups. But it was only 50 women and 50 men. So very, very small. And then things have continued to grow, mostly initiated by the DOJ coming in and demanding, additional resources. And that started in the 90s. And it started with one floor of people that they identified as, these individuals are so ill, they're at risk of being, they're not safe in general population. So we want to separate them and get them treatment. And then it just has expanded and expanded as, Philippe. So I love that presentation. That really broke everything down in a way that people can understand. Something that's hard to describe. Just since I've been there in 10 years, the population has doubled. And unfortunately, our staff has far from doubled. We can't keep up. So we'll try to get more staff, and then the population grows and grows and grows. We can't keep up with it. And part of it is that the positive thing is that we have gotten a lot better at identifying who needs it, but then it means there's more people that need our services, and we simply, just can't keep up, which kind of leads into the development of the program. And that was Dr. Ortego and Dr. Daftian, who were, well, let me explain first. So when someone is identified as having mental health needs, and you ask the difference between a patient and an inmate, and it's really just language, so custody uses the word inmate, and it's a descriptor. For us, everyone that we see is our patient, and it's important to remember that it doesn't really matter whether they're an inmate or where they are, they're just our patients. And so they are identified either by their history or by a referral from court, or showing symptoms. And so those are the people that we identify as our patients that we are going to provide care to. And so we have different levels of care. A dorm setting, or what we call high observation, where people are, these are people who are more unstable and need a higher level. They're seen more frequently, but also they may be just not able to function very well in a dorm setting. One of the things that really surprised me when I started there was that how many guys just weren't on medication. And I think that is a common perception of people will say, what do you mean you can't force them? They're in jail. But that is a whole separate court process. And so people can only be, there are exceptions, but I don't want to complicate it too much. Either a judge has to say they can be forced medication, or we have a very small inpatient unit that's called we call it a forensic inpatient unit. That's our licensed LPS licensed facility, but it only takes about 45 patients. And, at any given time, we have all these guys waiting. And And so the reason, so there were several, Dr. Ortego and Dr. Daftian, the psychiatrist who first started and had the idea for it, along with Sarah Tong, was that, what happens is when you're in high observation, a lot of times you're in your own cell by yourself for your safety and for the safety of others. But then that's the opposite of what somebody needs to get better, right? So they're decompensating. They get to the point that they have to be hospitalized and they're given medication. They start to get better. Then they're released back, and the same old cycle would happen again and again. And so the idea was, for the fifth step down, can we group these people together and give them the extra care that they need, the extra attention that they need, so that rather than cycling back and forth, we can keep them on the path of interacting with people, of keeping on their medication, and really keep them on the right track, keep them from going back to the inpatient unit, or in some cases, keep people from ever needing to go to the inpatient unit. And I don't know if I answered all your questions.
Yeah. And then where did the idea come from to actually use peer inmates in that process?
That was a captain, and I want to say it was Captain Mathers, who had the idea for using merit masters that originated with custody.
Okay. So I'm going to jump a little bit because I know people are anxious to hear from Craigen and Adrian, and we'll circle back on a couple of these things. So Adrian and Craigen, you mentioned that you were functioning as merit masters, and now presumably you're in Men's Central Jail, and somebody comes to you and says, hey, we have this brand new program we would like to introduce you to. Describe for us why you took the leap of faith. And did you know what you were getting yourself into? And a little bit about perhaps your first impressions when you were taken over to Twin Towers into the FIP step down unit.
So I think at the beginning, they didn't really have like a definition of what they were trying to do. They just knew that they wanted to apply us to the setting. And so I remember Sarah Tong, she's the on-call psych tech. She actually pretty much runs everything on a daily basis. She went over to Men's Central Jail, and she asked some of us if we would be interested to go and work with guys who are battling mental illness. I know myself, I wasn't allowed to go because I was working for the school program, and I had like a position over there that was, I guess I was being used a lot, so they didn't allow me to go. But over a few months, I guess they were taking guys, and it wasn't successful at all. They weren't equipped for the position. There was always little incidents, and so I know when the position opened for myself, I volunteered to come. I was really interested in being a part of something different, trying something new out. I'm not too sure how Craigen came about. I know he was already in school. He came a few months after me. I don't know if you want to share.
Yeah, so I was more looking for a more constructive environment. I know, so in the L.A.County jail, I think it's pretty well known that jail can be self-destructive. A lot of it is based on the individual's choices. So, I wanted to put myself in a more constructive environment. I felt like, being in this program, I could apply myself a lot more. So that was the motivating factor for me coming over. I didn't really know about, I've been incarcerated for a while now. So once I came to the county jail, I came from another facility. When I first came through being incarcerated, they didn't have school in the county jail. So it was new to me. I was kind of amazed when they first asked me, do you want to go to school? Because it kind of threw me off guard, like, it's school here. But initially, I wasn't allowed to go to school based on, my charge and where I came from. I wasn't allowed. So I had to go through some steps and kind of get clearance to be able to be enrolled into the school program. So I was pretty persistent, and I was able to, participate in the EBI program. When I got in the EBI program, I then learned about the merit master position, which is a role in the EBI program. And by being in the EBI program, I learned about the position over here in Twin Towers Correctional Facility, right across the street from Men's Central, where you would be assisting mental health, with inmates who are struggling with mental illnesses. So I looked at that. It was a different challenge. It was something new. And I felt like that I could, be of help based on my experience of being incarcerated and being around men with mental illness, but not really understanding it at the time. Being here and being around it now, I understood that I've been around this for a long time and didn't have no clue that what I was really around. So coming over here, what for me was an opportunity to apply myself in a different way and also put myself, I think, in a more productive environment as opposed to being across the street, where it's the atmosphere is a lot different as far as the individuals and, a lot of things that go on. So that was the motivation for me.
But I think
Adrian, I'm going to interject because we have a live chat going here, and there's people who and I apologize for not giving them a little executive summary as to what is a mental health assistant. So maybe if you could let's describe now, like if you were to tell us your job description, what you do, where you live, a little bit about who you live with, describe your job as a mental health assistant.
So we are in a pod, a pod is a unit. We'll call it a unit for people who don't understand a pod. So it's a unit, and it consists of it's a 16 cells and up to anywhere from 25 to 27 inmates at a time. We're in there as kind of like mentors to these men. That was our initial role as mentors. We're trying to take care of them. We may have to help guys shower, help them brush their teeth, teach them to brush their teeth. We make sure that they're taking their medication. We're trying to encourage them to do all these things, basically establishing healthy habits. So that's our role within the pod. We live in the pod with the inmates 24/7, 365 days a year. That's where we stay. We wake up with them every day, every morning. We're there with them. So our role is to kind of facilitate their process. They are going through their court proceedings. They are experiencing a number of different challenges, and we're there to kind of help them get through those. That's our role as a mental health assistant. We advocated to change.
I think the interference is coming from Sergeant Flores' office, so we need to unmute Sergeant Flores. And sorry, everybody, you'll have to put up with a little bit of sound because they're in somebody's office there. Right. Go ahead, Craigen.
I'm good. Yes. I'm good. Okay. Thank you. So yeah, we advocated to change our role because the name Merit Master wasn't the appropriate title for the work that we were doing. We were really assisting the mental health department, and being a Merit Master is a totally different role across the street. So we advocate to change our role, and the motivating factor or the primary reason for that change was because we want to establish a direct relationship with the psychiatrists and the clinicians, because we felt we could be of better help that way. We're living in a pod 24/7, so we see and observe things that clinicians and doctors cannot see, but they're treating them. They are prescribing medication, they're making diagnoses, and they're making them almost in like a snapshot. They only get a certain amount of time to talk to each individual. And I don't think they were getting the true symptoms, or they weren't getting a good read of the individual in that time. And we were seeing this. And we felt like, okay, if we can somehow open a line of communication with them, then we feel that it will help not only the psychiatrist, but the inmate. So that was our role to change that was our motivation to change our position and to be recognized. And that's why we created the mental health assistant, to be able to communicate with these people, because typically in jail, you're not, the doctors and clinicians, they don't really communicate with other inmates if you're not a patient. No other inmate in here working can walk up to a doctor or a psychiatrist or a clinician and really talk to them at all. So that was, a huge development for us. And it was more, trying to help, because we understand the amount of patients here and the time constraints, and they have to see a lot of people in a short period of time. And to us, we were saying that it's kind of hard to, really treat that way effectively without having, a lot the information that we have. We are seeing things and being able to convey this information that they can't have.
So I think one of the biggest keys too is so we're living in the pod with these guys, and a lot of them don't have insight into their mental illness. So because they don't have no insight, they don't believe they have a mental illness. They're experiencing these hallucinations, these delusions. Some of them are manic depressive. So they're going up and down, and the results are banging on the walls, on the doors, some of them smearing feces, and we're living in the pod with them. So we can hear we're talking about cement cells, and you can hear an echo through it. And it does, sometimes it's very taxing. It gets a little, you're talking about 24/7. When it's time for us to go in the cell and go to sleep, we can hear it still. So we're questioning this, like, what's going on? This person really does need help. And because they don't have no insight, we're thinking, man, we need to get to the doctors, the clinicians, the people that are seeing them and treating them. And we got to relate this information, because when they come and see them, these guys are highly sophisticated. We're talking about, they're telling them everything's good. We're going through our days. We're fine. They're just trying to come in jail, get out, and just pass through. So our idea was, we got to create the mental health assistant position, because merit masters are not trained to deal with this. And at that, we used to wear blue pants and a white shirt. So when we're walking around the areas, that you got the clinicians, the doctors who think we take medication as well. They're thinking we're a patient. And so our word isn't really credible. So what do? We create the position mental health assistant. We change our apparel. I wear white pants and a blue shirt. On a daily basis, we're walking around. They see us. We look a little different. We stand out. We can relate the information to them. Now they start to question, okay, we put a book together. We create trifolds. We create all these different resources, and we start relating the information to them. So now when they come to us, they're like, okay, let me hear what you got to say. And I think over time, over the years, they start to see that they're more effective. In a way, it's just them appreciating us. I don't want to go too far, though.
Yeah, I will point out, and I know that there's a lot of interest, a million questions in the chat, and I will point out, we did do a podcast with you guys a few months ago for an hour straight, and a lot of the day in the life of Adrian and Craigen was laid out in that podcast, and I'll make sure that I put a link to that in the chat as well. But I want to go back up to Jeremy, because Jeremy, you've been doing your research in jail settings, both back at Rikers and L.A.County. Tell us about what happened when you encountered Adrian and Craigen. What did you notice? What was unique about what they were doing? What made it so special? And why is this something not happening on a larger scale across the country?
Those are big questions. And I'll just speak briefly and say, and just give a special shout out to the psychiatrists and other mental health workers, physicians that really were so generous with their time and letting me join them and taught me many things. And one of the things that, and this is kind of me speaking as a medical student here, so a couple of the lessons that I learned. First is just how complex it is to provide care in these settings, and the complexity. And I think there's, from Philippe's presentation, when we look at the need that exists, I think we should all feel, especially in the medical side, feel really responsible for all that care that needs to be provided, and know that actually people that are working oftentimes are doing a really great service. But I think in addition to that great service, there's also sheer complexity and the patients who are experiencing really challenging patients and who need a lot of attention and time to kind of work through what it is that they're experiencing. So special shout out to Dr. Kolovskaya and many other mental health workers who have taught me kind of a little bit, just a brief window into that challenge. One of the other lessons that I've learned from being in settings is just how important teamwork is. And I see a lot of kind of critical people, and I just had a window into the unit, the pod, Sarah Tong, the psych tech, psychiatric technician, Lomita, a group provider, Quadros, who's a social worker, as well as Deputy Casas, have all just been really indispensable. So I think one of the lessons as a medical student is just how important teamwork is, to be working with people, working together to give people the attention and time that they need as they're kind of experiencing things. It's kind of the way to express solidarity and the way to kind of build any kind of understanding. But then I think the lesson, one of the many, many lessons that I've learned from Craigen and Adrian is just how much potential there is and ingenuity there is once we kind of partner with incarcerated people and learn kind of what their embodied experience, what their accrued wisdom from being there may have to offer, and the kinds of insights that really oftentimes they're the only ones that can provide. So, what they emphasize in the book, which you all should absolutely buy, I think the link is now in, so please do buy the book, is as the solution really does need to go through oftentimes working with incarcerated people, that it's actually, sometimes we think, send people away and have someone else deal with this problem. And I think, the walls are thinner and shorter than we imagine. And there's so many people that are really having these experiences. And I think as we think about one of the things that, and I hope this is Craigen and Adrian, correct me, but I think when you have all just emphasized that, talk to us, ask us, listen, and kind of learn about some of the things that we can uniquely tell you about what people are experiencing, about the kinds of challenges, and we can be part of the solution. So that's, their message is, and I just want to echo their words that I think, I hope you all take seriously and buy the book.
Joan, a question for you. So now for 4 years, and you obviously picked the right guys with Adrian and Craigen. From your perspective, is this proving to be a success? And how are you measuring success? Make a case for expanding this program into other places.
Yeah, obviously it's a huge success. And I do want to say I'm here representing mental health, but I really can take no credit for the fifth step down and how successful it's been. So many of the names have already been mentioned. And it's a team working, and Sarah Tong, who I had hoped to have sitting next to me, really had the vision from the beginning. I think sometimes the simplest things are the most profound, like the fact that she could envision what it would look like, because when you're in a jail and everything, the environment is so deprived of inspiration and beauty and things that make us feel like, oh, you know what, there's a little hope. I see a plant, I see something alive. From bringing artwork and plants and fish to like really bringing the program together. And so when I asked her about how she chose Craigen and Adrian, and she said, actually, I didn't get to choose them. They were sent, but I think one thing is that it's self-selecting, that they're signing up for a very difficult job, which they just described, living 24/7. They're basically volunteering to be in service to others 24/7. And so I think the measure, like part of it, any person who comes in and looks at the jail and looks at the difference between the other floors and how you can see the inmates, there's a hope in their eye, they're engaged, it's just, you can visually see it. But we also looked back in 2019, we looked at how could we measure it? And by measuring the incidence of self-directed violence, which is, if for anyone who's not aware, someone hurting themselves, it 6 times higher in other pods compared to the fifth step down. And then we also looked at, was it successful and its goal of keeping people from having to cycle back into our inpatient unit. And there was a 35% reduction in readmittance to the inpatient unit. So those were 2 data-driven things, but really you don't even need the data to just look at it and see how successful it is.
So, Craigen and Adrian, can you explain what compelled you to write a book? And I will point out that you had to write the book with a 3-inch pencil. You did not have a computer. You did not, there it is. You did not have a typewriter. And also, even the reference books that you needed to do your work had to be cobbled together. So tell us what compelled you to write the book, and what was that process like for you?
So I think there was like a lot of different things that pushed us to put the book in motion. I think over time we just compiled a bunch of different writings, and like we created a curriculum for the guys that we teach to like on a daily basis, life skills, self-education, like your spiritual side, a little bit about core competency. And so we created this, and then we went on to create a training program. Miss Sarah Tong, she encouraged us to create some sort of training program for guys who wanted to become mental health assistants. And then we had created a couple of trifodes for different tours that were coming through. We wanted to pass them out to pretty much encourage them to check us out, what we were doing, what our methods were. And so I think there was one time that Dr. Gage, he's a part of DOJ, Department of Justice. He had came through and he recognized and seen the potential in what we were doing. We gave him a trifode, and he encouraged us to write some articles. And so I think at that time, Craigen, he actually wanted to go and give him all of our compilation of resources and things that we put together to just tell him, like, man, we're working on putting the book together. But he didn't get that chance. So we were just like motivated just to put everything together and like finally get something that we could just place on the desktop. So whenever we get these tours or anybody that comes through that's interested, we could just give them a copy. We believe that we had a solution. We truly believe that we had something that can benefit. I'm talking about, we have tours from different counties coming through asking, like, how do you deal with mental illness? And I think it was just like barely starting to follow up in different counties. If I'm correct, they started saying that the mental illness epidemic was traveling to different counties. So they were coming over here to L.A.County asking, like, how do you deal with it? What do you do? And so we were like, man, we gotta get this book ready. We gotta put it out there, because what we're doing it works. It's effective. Like, we can't just hold that back. I think that's really what compelled us to put the book together.
Yeah, let me ask, for both of you, there's a lot of questions in the chat. People want to know if you're being paid for this job that you have. And I happen to know you're not, and you have volunteered for the program. But, Craigen, you're pretty passionate about the importance of providing work and purpose for people who are in prison and serving indeterminate sentences. Can you describe, in your own words, how important it is to provide a sense of vocational purpose for people who are incarcerated?
Yeah, so I've seen the benefits that it's had for me. Unfortunately, our past, it kind of stains you in a way to where, people will always see you a certain way, and there's this consensus thought that, if this happened, then it's nothing that you can, do for them. They need to be locked up. They need to be put away. And, I've experienced, from where I've been, a place with not a lot of opportunity. And, being in that environment is real tough. And I've witnessed a lot of men who just couldn't take it. They weren't able to carry on. And I know a lot of people that's no longer with us. And a lot of it is because you really have no way of kind of redeeming yourself anymore. You have no way of kind of showing your worth or your value based on the environment and the lack of another chance or opportunity. So for me, it's important for me to kind of provide that path, and if I can, try to make room for more opportunities. So that's why, a lot of what we do is for the patient, but it's also for individuals like ourselves that, are trying to show that, we still here, we still matter, and, we're trying to get better, even though, we may have made, some bad choices in the past. So that's where a lot of the passion comes from, trying to provide that for those that are still behind us.
Can I add a little something too? So just real quick, I think, so first off, I think it's needed. I think the mental illness epidemic is taking over. We need somebody there. I'm talking about, like, we have care right now, and it's good, but we need something that's intensive 24/7, because we see that it works here, and outside, I know people have their daily lives. So we think that getting somebody that's in prison, that should be in prison for long periods of time, I think they're perfect candidates for it. I mean, you got a lot of people who are trying to show a difference in themselves. I mean, for myself, I can say I've caused a lot of destruction and pain in my past. And I mean, who doesn't want to be better from their different choices, right? We make choices and they're bad choices, and we want to make better choices. And I think during this course of time in the county jail, we start to realize, like, we need to make better choices. And so this is a perfect opportunity to come and change the way we think. Why? Because with our old thinking, we can't go and treat somebody the way they need to be treated. These guys that are battling mental illnesses. How do you treat them with the same type of thinking that got you in jail? So it becomes inevitable. Like, it's bound to happen. Your thinking is going to transform. And so we're talking about guys, new laws are passing, guys are coming back from prison. You got guys who are getting let out on different new laws, and then guys that are serving 20, 30 years who are going to be out pretty soon. And so these are the guys that you're going to be around in your neighborhoods. And so I think this is a perfect time to start shaping the way they think and giving them opportunity to learn something different, giving them a chance to make better choices and change themselves. Because I don't think you want somebody that's making the bad choices going to jail right back out there in the streets. So I think that's why it's absolutely necessary that we provide this opportunity. Why? Because we got mental illness that needs it. And then we got these guys that are going to be out and in our communities that we need to contribute. We should be growing instead of condemning them where they don't have opportunity anymore.
And it's so many facilities, it's so many jails and facilities that it's not that much opportunity for a person to. And this right here, it kind of forces you to deal with problems different. I mean, the way you have to communicate, the tolerance you have to have, the patience you have to develop. It's a challenge living in the pod and, trying to treat individuals with these type of illnesses, because it is, I've been assaulted, you've been assaulted, you've been disrespected a lot, and you have to figure out other ways on how to deal with that. First, understanding that the patient is dealing with the issue, but it takes a lot of self-restraint, a lot of tolerance, a lot of understanding, a lot of communication to treat the individual the way they should be treated, and to learn how to deal with those type of offenses. And some guys, it's a challenge for them, a real challenge, even though they know the patient is suffering from mental illness. It still can be taken personal, and it develops you in a way to how to deal with that. So
we have our method in the book too. We have our method, the way we deal with it, and so you want to say
and what I love is that you guys have pretty much given up all your intellectual property, and you have shared everything from your curriculum to the quizzes to how you provide incentives, and you have been very abundant in sharing your intellectual property. So Bruce, I want to ask you a question. So with this, Joan obviously outlined some of the successes, and we can sense the care and the patience and the kindness that just emanate from Craigen and Adrian, and kudos to the LASD for embarking upon this pilot. And I know it's been recently expanded. How can you, as a person in law enforcement, and especially involved with the carceral environment, make a case to expand this kind of peer involvement on a much broader scale? And do we run into union issues there? Like, what's the challenge there?
No, so I think the biggest challenge is just changing the perception at the line level for the custody staff and the mental health staff. So just to backtrack, so when Craigen and Adrian were describing, how they came into this program, and they're the ones that actually came up with the idea to title it mental health assistance, because For those just from an institutional setting, the traditional verbiage is, they're trustees. And so the captain that Joan mentioned at our Twin Towers facility back then, it's a leap of faith to see we need some help from the trustees in some of our housing locations. And who are we going to get to do it? And so looking for volunteers, he had the foresight to think, well, let's go to the Merit Masters, which were some of our inmates who have, dedicated themselves to improving and educating and making good use of their time. And just getting on that path to redemption that Craigen talked about, right? So it's like, and I'm a big believer in that. So even anyone who's found themselves in this situation, even under the worst of circumstances, to hope that there can be a path to redemption, I think is incredibly important. So the captain decides, where can I go to find individuals that are actually going to be willing to try and work in this environment, which is, it's incredibly hard for the custody staff and the mental health staff. And now we're asking, some of the inmates to make this leap and will you come over and try and help us out? And that's where we got Craigen and Adrian to volunteer and come over. And then it's the leap of faith on our part to I've got individuals that are high level security classifications that normally might be considered dangerous, but we start looking at it as how are they interacting with other individuals inside in the custody environment. And these guys have proven to us that they're worthy of more freedoms, right? And so, and you mentioned that there's no pay, it's volunteer. So in the county jail system, we don't have a pay process for any of the work, but we don't make any money off of anything we do here. So, there's no prison industrial complex, so to speak, in the county jail system, but we want to provide, activities, as Craigen talked about and Adrian talked about, for their own self-worth that they feel are worthwhile. And so they come over, and are we going to allow them additional freedoms? And they do get additional freedoms. So the pod that they're talking about, they have to go through a locked door to get in that pod. And then the cells themselves can be locked. And you're dealing with individuals with mental health issues that where they're helping us is to help them to get out of their cells and be treated like human beings, as opposed to when they're first brought into some of these pods, they're acutely mentally ill and they're a danger to themselves and others. And just us trusting Craigen and Adrian and other individuals, because we're expanding the program. And one of the hardest things is to try for them to recruit other Merit Masters and other individuals in our system and show them, how this can be a worthwhile endeavor for not just the individuals in the pods with mental health issues, but also for our new mental health assistants, our new trustees that are also trying to find this path to redemption and doing something positive in their lives when they've personally seen a lot of struggles and heartache throughout their lives. So that's where we needed to do it on the custody side, is just make that leap of faith that you can trust these individuals to do this kind of work and just increasingly give them additional responsibilities and additional freedoms.
I do want to go back to Craigen and Adrian just to share a couple things here. We've been in a pandemic since March. It's been more than a year, and it's been hard on everybody, but it's been particularly hard on people who are in a jail and prison. And can you describe a little bit about what it's like for the inmates during a pandemic? I think your mothers are watching this today. When's the last time you've actually seen family members? What's it like to try to make phone calls? And how isolating has it been for the men that you are taking care of?
Yeah, I haven't seen my mother since, I think, the pandemic, probably like last April, maybe about a year or so. But I think, so where we're at particularly, it's a challenge. Really, it's the visits, the lack of communication. Not everyone is fortunate enough to use the phone like that. The calls are pretty high. But, I have to say, for us, where we're at, we haven't had it that bad. There's been some other areas in the jail that we've heard about, maybe throughout the state, where it's been real bad, especially across the street. But fortunately, in our program, we've been running pretty smoothly aside from a few quarantines that we've had. And those have been managed pretty well. So I think the precautions we've been taking and a lot of the measures we've taken, it hasn't affected us in a sense where it's really created a real challenge for us. The thing that I think that, was eye-opening to me is that we have a lot of guys who they're not even aware that it's a pandemic going on. So that's one of I think the unique challenge with it is trying to, instruct them to wash their hands, shower regularly, wear your mask, and they have no clue why they're even wearing it or why they're even putting it on. So, that was something that kind of, that was eye-opening for me. It just goes to, how appreciative you have to be for your mental health alone. We kind of take it for granted, but that was, something that I learned. But I think it's tougher for the families who can't see their loved ones. Being incarcerated, you learn how to deal with challenges. It's a constant change. It's a lot of challenges that involves being incarcerated. So you kind of get this ability to adapt a lot. So that was just another challenge, a unique one, but another one. But I think to me, it's harder, like for my mother, not being able to see me or hear from me as she would like to. So for me, I think it's tougher on the people on the outside.
Adrian, do you have any thoughts?
Yeah, I agree with him too. They closed the visits, I think April, the year of COVID-19. So, it's just more harder for my family. The phones are kind of expensive. And I don't want to bad talk the county or anything like that, but yeah, they are kind of expensive. Probably pay an iPhone bill multiple times in 1 month. But for the guys, yeah, just like he said, they don't even comprehend that there's a whole virus taking over and people are dying. That should give you a good picture, like what we deal with on a daily basis outside of the COVID-19. Like we got guys that they're just dealing with that consistently, like on a daily basis. So, I can only imagine they got family members out there who are concerned. And a lot of these guys, they don't even go and take initiative and use the phone. We encourage them. A lot of them don't know how to use the phone. A lot of them, like we said, they're battling schizophrenia. So a lot of them don't have, they're just not in the right state of mind. You do have the Department of Mental Health, the clinicians, things like that, who get in touch with the families, but I think it's like very minimal. So it could be really tough for the people that are out out there, the families that are concerned for their brothers or sisters or whoever is battling mental illness in jail that ain't getting in contact with them.
So, I had, 50 more questions that I couldn't ask, but you always want to have more questions. And this has been so rich. So what I want to do with this last 9 minutes is for each of the panelists. In L.A. County right now, there is a movement. It's called, Alternatives to Incarceration. It's an initiative to be looking at different ways, better ways, more humane ways to address the needs of people with mental illness who have unfortunately entered into our system of incarceration. And I think Judge Songhai Armstead was on this, the audience here. I did see her in the chat. I don't know if she's still there, but here is an opportunity for each of you to talk to the people who are thinking about alternatives to incarceration for people with mental illness. If you can just give 1 or 2 sound bites that you think are really, really important for policymakers right now who are grappling with this for the future, what would you offer up? And then the last word I'm going to give to Adrian and Craigen to share a vision they've been working on, which is an alternative to life after incarceration. And that you'll have the final word on that. But let's start with Philippe. What should the Alternatives to Incarceration policy group be thinking about?
So it's housing for people with serious mental illness, it's care for people with serious mental illness, and it's for changing the paradigm from punishment to solidarity and health and treating them as fellow humans who are people that should be respected.
Awesome. Thank you, Philippe. Jeremy. Jeremy.
I think it would be good for people to engage themselves in the conversation, the public conversation. And then I'll just emphasize that I think there's a lot of promise and to shifting towards a care economy and valuing care providers, people doing a lot of care that is not appropriately valued, that keeps us alive, that keeps exactly the kind of work and the vision that Adrian Armstrong set forth, but also just we should emphasize their words and their story.
Adrian and Craigen, alternatives to incarceration. What would you want these policy leaders to be thinking about?
I think number one is to think outside the box. I think a lot of times we're so caught up in what we do all the time. I think we continue to try to make what we're doing right now better, but I think sometimes you need to just get creative and just think of something different. And we will share a little more in the vision, like how radical and different we're thinking outside the box. But I think that's number one. I don't know if you want to give.
Yeah, so and the vision we do have is out of the box. And we believe that that's what it's going to take. And based on our experience and what we've been witnessing over the past 4 years, we're confident that we need to do things that are a bit non-traditional or non-conventional to, kind of help the situation that's going on. The epidemic right now, especially with meth, is a huge challenge that has kind of baffled the whole system, and it's like no one kind of knows how to really treat it, and it is difficult, it is hard, but we have the ability to have very, very, very intimate conversations with these men that they will have with no other, and we have information that we believe we can put to use for their benefit. So, and that was the idea and the motivation behind the vision. It was kind of born out of a sense of, for lack of a better word, maybe frustration or desperation to do something. And that's why it is, in some people's eyes, it could be a little far-fetched, but it's needed. And we're confident that it will work.
Okay.
Don't be afraid to fail.
We'll come back to the vision. You'll have the last word. Bruce, alternatives to incarceration. What seeds do you want to plant?
Yeah, I think just piggyback on what Adrian and Craigen there said. So what they've helped us with is showed a model where, you have individuals that we had housed, locked in cells for the majority of their day, and they're having limited exposure, and they progress with the help of the staff and these guys to the model that they have now. You have them all out at the same time in open housing areas getting along. So it shows that a care first approach focused on the mental health needs can change the behavior, and we can have a different way of living and a different way of treating all these folks. So, and it doesn't have to start inside the jail operations. Like if you could start it outside, like these guys are saying, they've seen it at work. We just have to come up with a model where they're getting the care and treatment in a secure environment, but it doesn't necessarily have to be a jail environment. We need to rethink that.
Joan, alternatives to incarceration.
So I think, it's already been said, we need so many more services in the community, inpatient particularly. And I guess what I would add to that is, in my 25 years, I don't think I've ever met a client that didn't have some type of trauma in childhood. And so anyway, any resources we can apply to intervention in childhood is just going to have multiple, because once you get off track, it snowballs and other things layer on top of it. And I think learning from Craigen and Adrian that, there's no substitute for one-on-one somebody seeing you, somebody hearing you, validating you, no medicine, no clinician is a substitute for that. And that, you know, these creative ideas that we don't have to be always wedded to a license, like this person is licensed to do this. Look at the amazing work that they do just by really caring and listening.
Absolutely. So, Craigen and Adrian, just in 2 minutes, because then I'm going to want to wrap up. If you can give a little glimpse into new life creating community, and, you know, I've been helping you get this typed up. You wrote it again with your 3-inch pencil. This is for life after incarceration, because you keep seeing so many people cycle back into your pod. In a few words, what is a better way to do life after incarceration?
Yeah, so for us, a lot of it is based on what we've experienced inside the jail. And this, I mean, it's not a discount on the department or anything, but this place is not designed for people with mental illness. And we don't think that, you know, people with mental illness should be, you know, thrown on the sheriff's department. So it should be treated by, you know, individuals who, especially like ourselves, who we're in a like position, we understand, but who can provide the care that is needed. New life creating community was an idea, as I said before, we were seeing a lot of our patients come back to jail. And these are guys that you once they left, you had faith, or you had this belief that, okay, yeah, he's going to be okay. He's going to be all right. And then you see him back and he's in bad shape. And I would say at least 80% of the guys that we see come back is meth related. And we had these conversations all the time about ideas and, you know, what is the solution? What can we possibly do? And we came up with this idea. What initially started out, as you know, Carrie, we had this new world idea. We wanted to create a new world just for them. And we had to kind of minimize it, you know, so it could be written up and piloted, and it became New Life. And basically what it is, it's a place where it's like a reservation. They would live there permanently, but they would have everything they need and possibly desire to be there and get the proper care and help without meth. And that was the thing that was important to us, is to kind of remove them from these environments where these habits and these influences are, because they do not have the capability or the ability to manage themselves in that way. They're very incorrigible. We have guys who, I mean, right now in the pod, someone could take them and offer them something, and they will take it. They don't have that restraint or that self-control to say no sometimes. And we see it all the time. And they're constantly coming back. So we figured, okay, let's what can we do? And it's a place that based on our experience, education programs and courses and educational courses are great. Drug programs are great. But it has to be something that equally matches this substance. And that's a lot of how it's designed, and how we came up with the idea is basically to match that kind of experience that you would get with meth. And, you know, I don't want to sound despondent or negative, but, you know, from what we've seen, a drug program cannot help a person get off meth. It just, I mean, it's not. And in our view, it has to be replaced. And that's what New Life will do. It will provide them with activities and a life that is enjoyable without drugs. So, I mean, we could share a lot more on that and talk about it forever. I think the biggest thing though about New Life creating community isn't we're not trying to fix anybody. And I think that's the biggest thing. We're trying to fix something. I think a lot of times you're giving these medications, you're encouraging somebody that has mental illness to take medication because there's something wrong with you. We're only trying to help guys and girls and whoever's battling mental illness. We're trying to help them live well and thrive for years.
I mean, just like us, we want to live and grow. That's all we want to see. We want to see them grow. And when we say that it's closed, it's a reservation. It's only closed from the outside coming in. It's not to keep them from leaving. They're not going to want to leave this place. Our idea is so good and so far-fetched that people that aren't battling mental illness are going to want to come in. Yeah. They're not going to be allowed. That's what the security is for.
I will attest to that. And we are going to find the proper way for you to share this vision. It's almost ready for prime time. So I just want to say, first of all, I know Christina and Jennifer are on this Zoom, the mothers of Adrian and Craigen. And I just want you two to know that we are so proud of what your sons have accomplished. I have had the opportunity to talk extensively with them over the last year, and I find their hearts to be incredibly soft and kind to the people. They are doing impossible work. You'll hear from my podcast when I said, when was the last time you saw sunlight? And you'll note that New Life Creating Community has a lot of sunlight built in. These men have been embedded since 2017, 24/7. They don't take a vacation. They don't have a day off. They don't get to run out for a bite to eat. They have been 100% embedded, caring for the most seriously mentally ill patients at L.A.County Twin Towers. And there's been a lot of incredible comments in the chat, which we're going to try to cut and paste so you guys can read them, Adrian and Craigen. But you're doing God's work. And I'm just so thrilled that we've all had the opportunity to help shine a light on the good work you're doing. And I thank you to Bruce Chase and to Joan Hubble and to the leadership at LASD and Twin Towers and Jail Mental Health for having the vision and being proactive and bringing this extension of kindness into E&F Pod and for expanding the program and continuing to believe in it. And to Sarah Tong, the mysterious Sarah Tong, who I've heard so much about, but I still haven't met, for her work as well. And
Deputy Casas and Deputy Alvarado, they do great. I mean, it's a whole team, 141 floor. It's
everybody involved. It wouldn't work without everybody. And that's why we want to say thank you also to Jeremy and Philippe. You know, we spent countless hours, having conferences and talking. So we learned a lot of our information and a lot of our education came from people. We did a lot of studying on our own, but it came from individuals, Sarah and people we were in, talked to, great doctors like Ali and Boltazan, who came in and spent time with us. Jeremy and Philippe specifically, though, we spent weekends having these exchanges. So we learned a lot from that, which helped us too. And it's a lot of people on the floor too, group providers like Lomita and clinicians like Quadros. And I mean, all these people involved, they're not on the podcast or on the Zoom, but they play a huge role in everything working. So, we want to say thank you. And to Bruce,
thank you.
A lot of what we've done is he helped us facilitate a lot of that, or it wouldn't have happened. So, we very appreciate it.
Carrie Morrison, Hard Forward, great.
Awesome. All right. And so let me tell you all, and you already thanked Philippe and Jeremy, and you did a great job. I'm so appreciative of their valiant advocacy for the good work you're doing. So everyone, so that you know, this will be available both via a YouTube on the UCLA social medicine website. We will send out to everybody who gave us their email to register today that information. We are also going to upload this as a podcast to Heart Forward, Conversations from the Heart, in May. And we will provide a lot of the links that you heard reference to today, the book, obviously. And also, Adrian and Craigen told me that they have created a GoFundMe campaign so that they can purchase books to give away for free. They make a super teensy-tiny amount of money. They published this book on a self-publishing platform, but they want to get the book into the hands of policymakers. And so they've created a GoFundMe campaign to do that. And we will include that in the links as well. I think that's everything. We are going to
count to us. Reach out to us.
We're
more than willing and ready to contribute in any way. If anybody has questions, I've seen a lot of questions in the chat room. Where you can correspond with us, emails, via USPS mail, anything. We're ready to work. We want to expand and grow, and if we will
include that as well, all the ways. So to all of you, thank you to the audience who joined with us today. It was just so great to have you. Thank you for your patience on this massive Zoom panel, but I think we actually pulled it off. Yay. All right. Have a good day, everybody.
Joan, thank you, Joan.
Thank you so much.
Thank you, Craigen. Thank you, Adrian.
Craigen, Adrian, thank you very much.